piriformis is one of the deep external rotators. I don't think, and there's always a lot of talk about locating the piriformis and exactly where it's situated. I like to think of working all of the deep external rotators, and that's what I'm going to bring for you today, because singling out just one muscle in regards to sciatic pain, I tend to find it's probably a little bit short-sighted. Okay, so let's look at the setup here. Obviously, we're going to come in once again with the broad forearm. Okay, so I'm going to pick up at the greater trochanter. Okay, so push back towards me. All right, now what we can do here is we can pick up some of the trigger points that lie in and around the greater trochanter. Okay, and then trust me, there'll be quite a few. So we're just going to sink in and then lock down onto that greater trochanter here. Now we can move the leg around a little bit, okay, and that way we can feel whether or not some of the muscles working underneath our forearm. And then once we can pick up some of those sensitive areas, we can just lock down. So you're going to pull your elbow in towards you and then press down and pick up those points. Now you're right away from the sciatic nerve because you're up right close to the greater trochanter. The actual nerve itself runs deeper through the mid part of the buttock, so you won't have any issues about hitting the sciatic nerve itself. Now what we also can do is come into the top around the actual sacral border itself, sink in here and work some of the trigger points at the attachment site, and trust me, there'll be a few there too as well, and just working up along the border of the SIJ as well. So just sinking in, allowing it to relax, dissipate, add a little bit of movement as well. Always find that that helps an enormous amount as well. And then change your direction, locking in towards you as well, then sinking down. That's the key.